Hi, we have created a series of videos to assist you in our hip replacement rehab program. I'm going to be running through in this first video exercises that are important to be done in that first week after having your hip replacement. And then I'll follow on with week 2 to 4 and also week 5 and plus. So to begin with, day 1 after surgery, they actually commence you doing exercises straight up, so as soon as possible. Our physio will come around to you and they'll encourage you to try to stand up and go for a walk with them, usually with assistance of a frame of some sort, just to take the load off your legs. It will be uncomfortable, but it's a really important step in the healing process of your hip, getting that weight through the joint. So you'll do as well as you can at this, and they'll just encourage you on and get you using less and less of a frame over the next few days. They'll also want you to commence some muscle initiating exercises. So basically, when there's pain to an area or a joint, the muscles surrounding it usually shut down and they just turn off. So probably from before you had your operation, you were having pain around your hip, so the muscles wouldn't be working normally to begin with. And definitely since having the surgery, your muscles will kind of just have stopped working. They're still there, they're just not turning on. So the next 2 exercises I'll show you now are to get them just firing so that they're ready to use when you do more normal movements. So I'll run through those now. You don't want to be on the ground because it's going to be hard to get up. So lie yourself on a bed or somewhere comfortable. You'll be flat on your back. And the first thing I want you to think about is where your bottom muscle is. So your glute muscle sits down in here, and it's really important in your hip program. So I want you to find where that is and think about how to squeeze it. So lying down, you want to squeeze your bottom as hard and as tight as you can, and you're going to hold that for 10 seconds. So you'll feel your bottom rise. I'm holding it up at the moment, and you're going to go as hard as you can for 10 seconds and then let it go. It's a really simple exercise, but it does get your muscles going and it does get them firing. So that is the first exercise, which you'll repeat 10 times for 10 seconds just to get enough action happening. Another muscle that's important to start firing is your quad muscle. So the next one's going to be about squeezing this quad muscle. So to do that, I want you to think about pushing your knee, the back of your knee into the bed or into the ground. That's going to get this activated. So if you have a go at that, you can do it lying or you can sit up like this and just think about back of the knee into the ground, squeezing as hard as you can. If you're above me, you could be able to see that these muscles have bulged up. That means that they're firing. So you want to hold that hard as you can for 10 seconds. And you'll find that it actually works the muscle and does more than you'd think it would be doing, and then relax. So again, you'll be repeating this one, 10-second holds, 10 times. The next important movement to do is to get your range in your joint back. So it's a new joint in there and your body's not used to it moving at all. So we want to start to get it flexing and also moving out to the side. So next 2 movements and exercises are for your range of motion. So to begin with, you'll be lying on your back. This is the hip you've had done. You're going to slide the heel of your foot up as high as you're comfortable and then back down. And you'll be repeating this movement slowly and steadily 10 times. If you get to the point of pain, feel free to stop at that point. Never push through more than a 5 to 7 out of 10 on pain, and then come back down. And you'll find your body with repetition will get more used to it and you'll be able to move it further. So I'd encourage you to do 10 or 20 of those in a row just to warm it up. The next movement is getting the hip abduction movement, which is going to be the leg out to the side. So lying on your back, think about dragging your heel of your foot out to the side as far as you're comfortable going and then bringing it in. And you'll feel a nice stretch through the joint, and also obviously your muscles are working there as well. So you want to repeat this one 10 to 20 times as well. Alrighty, so with 4 basic exercises, it's a great place to start. Plus obviously walking and getting up as often as you can. Alrighty, good luck to you.